Emergency medical technicians (EMTs), military medics, and emergency room physicians could one day be better able to treat victims of vehicular accidents, gunshot wounds, and battlefield injuries thanks to a new device under development that may more accurately assess the effects of blood loss due. A research team has now shown that it can accurately assess blood loss by measuring seismic vibrations in the chest cavity and by detecting changes in the timing of heartbeats. The knowledge, developed in the laboratory, could potentially lead to development of a smart wearable device that could be carried by ambulance crews and medics and made available in emergency rooms and surgical facilities. We envision a wearable device that could be placed on a person's chest to measure the signs that we found are indicative of worsening cardiovascular system performance in response to bleeding, said Omer Inan, associate professor in the School of Electrical and Computer Engineering at the Georgia. Based on information from the device, different interventions such as fluid resuscitation could be performed to help a victim of trauma. The research, supported by the Office of Naval Research, was reported July 22 in the journal Science Advances. It included collaborators from the Translational Training and Testing Laboratories in Atlanta, an affiliate of Georgia Tech, and the University of Maryland. Blood loss can result from many different kinds of trauma, but the hemorrhage can sometimes be hidden from first responders and doctors. Heart rates are normally elevated in people suffering from trauma, and blood pressure, now the most commonly used measure of hemorrhage, can remain stable until the blood loss reaches a life-threatening stage. It's very difficult because the vital signs you can measure easily are the ones that the body tries very hard to regulate, Inan said. The researchers wanted to evaluate externally measurable indicators of cardiovascular system performance and compare them to information provided by catheters making direct measurements of blood volume and pressure. The key indicator turned out to be a seismocardiogram, a measure of the micro-vibrations produced by heart contractions and the ejection of blood from the heart into the body's vascular system. But the researchers also saw changes in the timing of the heart's activity as blood volume decreased, providing another measure of a weakening cardiovascular system. Machine learning algorithms would use the measurements to generate a simple numerical score in which larger numbers indicate a more serious condition. In future work, Inan and his collaborators expect to create a prototype device that could take the form of a patch just 10 mm square. Additional electrical engineering will be needed to filter out the kinds of background noise likely to be found in real-world trauma situations, and for successful operation when the patient is being transported. Too much fluid can cause edema, similar to the conditions of heart failure patients whose lungs fill with liquid. This material is based on work supported by the Office of Naval Research, ONR, under Grant N0001418125779. Any opinions, findings, and conclusions or recommendations expressed in this material are those of the authors and do not necessarily reflect the views of the ONR. Please support my channel to grow by pressing subscribe button and the bell icon. We will notify you new tech videos. Thank you.